This video is to demonstrate how to use the DT-600 product 602 from Zopec Medical. The 602 treats non-neuropathic pain or pain that is from the damage of nerves. It can be caused by injuries to muscles, ligaments, bones, or other connective tissues. The pain is often described as sore and aching. The hand and finger pain can be due to repetitive motion injury like carpal tunnel, lifting, playing sports. The foot pain could be due to running, standing for long hours, hiking, poor posture, flat feet, things like that. The DT-600 could also be used for holistic health improvement through reflexology. Let's start with your DT-600 multifunctional electrotherapy device and assume you're ready to go with the batteries installed. Connect the DT-600 to the dual foot electrode. Make sure that the electrode has been cleaned with an antibacterial, non-alcohol wipe. I know you're looking at an electrode with a foot impression on it, but we're going to show you how to use this for single hand treatment for non-neuropathic finger and hand pain. Just consider that each side of this pad is an electrode. Never use this device for two hands like this, because that would cause an electric current to go across your chest, across your heart, which may cause cardiac arrhythmia. So just use it for one hand. Let's see, place your hand on the pad. Actually, what you'll want to do is place the palm on one side and your fingertips on the other side. You'll press the mode button, the M, to toggle the unit on. Repeat pressing the pulse mode button to toggle through till you get to T2. I'm on T2 now. Start the treatment using pulse mode T2. Increase the intensity until the stimulation is strong enough but still comfortable. So for me, I usually feel it pretty quick, like right away, there it was. Increase it slowly and put it at a comfortable point to where it's comfortable for you, strong enough but still comfortable for you. Remember, the timer is automatically set to 15 minutes and will turn off at that time. For acute hand pain, try this for 1 to 2 treatments and look for improvement afterwards. For chronic hand pain, try this twice per day and look for improvement within 2 weeks. In addition, try the other 7 modes to see if any of those others work better for you. Work with your clinician to optimize the treatment and modify anything that you may need to. For finger treatment alone, you can also use this to treat just one finger. So you'd keep your palm on one side and lift to one finger or 3, whatever the case may be. If you just want to think, you might have a cut on one finger, as I did one time, and I just would place that one finger there, and the healing was really incredibly fast. You can try it that way. And what was I? Oh, the treatment, when you're doing this, the current is the same if you have all of your fingers on there or just one. So if you just have one on there, you will notice that it's stronger driven to one surface area than when it's spread out over more surfaces. We're going to repeat this basically the same thing now for your feet. And what I'm going to do is take this, let's turn it off right now, get it back to T8 and back to nothing. Now we're going to show you how to use this unit for non-neuropathic foot pain and foot reflexology treatment. Keep the DT-600 connected to the top of the foot electrode as we had it before. Turn on the device, pressing the M, repeat pressing the mode, and toggle through to the pulse mode until you get to T5. So T2, T3, T4, T5. Once on, you probably know it, you've received a remote with this device. You can use the remote. The remote will not turn the unit on, but you can use it to change modes. I'm in 6, 7, 8, and I'm actually going to have to, I can go through to 1, I haven't turned it off, so I can still go back up, get back to my T5, and now I can increase intensity with my remote as well. I feel it right away at 1, but I can go up to about, on this one, probably about a 6, and feel still pretty comfortable. The remote has a feature that you cannot be too far away from the device. You'll need to stay pretty close to the device, about 2 feet away, and you do need to point it right at it for the remote to work. And that's a safety feature. So get it to the level of stimulation that you want. Keep pressure strong on there. If you're standing, it's obviously really good pressure. If you're sitting, you might need to kind of drive your feet, press your feet into the unit. The timer's automatically set, like I said, so it will turn off after 15 minutes. For acute foot pain, try this for 1 to 2 treatments and look for improvement afterwards. For chronic foot pain, try this twice per day and look for improvement within 2 weeks. In addition, try the other 7 modes to see if the outcome is better. And like we said with your hands, work with your clinician to see if they have any other suggestions. Finally, we'll end with a quick note, a little quick discussion on foot reflexology. A treatment where the therapist works on reflex points on your feet. The theory behind reflexology is that these reflex points relate to specific organs and glands in the body, and stimulating those points promotes health in those organs and glands via the body's energetic pathways. The 602 stimulates the entire foot, which imitates reflexology massages. It will not target one area like you can do with finger massage, but all areas are stimulated, which suggests that you may find benefits in other areas of your body from using the DT-600 on your feet. For foot reflexology treatment, repeat steps above. Use this twice per day, try pulse modes 2, 3, and 5, or any others that might work for you. Do 15-minute treatments, and again, the unit shuts off after 15 minutes. Now remember that your DT-600 device can be used with a couple other things if you want to expand your treatments. It comes with a 2x4-inch pad, adhesive pad that you can use in some other areas, and also a hand pad, which is strictly for hand neuropathy. If you have any questions about those devices, please contact your clinician or whoever you purchased your DT-600 from. Thank you.